Hello buddies. Today, in this video we will talk about the structure and functions of the kidney and the formation of urine. Introduction. The kidney performs many important functions to regulate the internal environment of the body. It is the main regulator of all the substances of body fluids and is responsible for maintaining homeostasis. The major functions of the kidney are to excrete metabolic waste products as well as to maintain water, pH, electrolyte balance, production of calcitriol and erythropoietin. The functional unit of the kidney is the nephron, which is composed of the Bowman's capsule with the glomerular tuft of capillaries, the proximal convoluted tubule, the loop of Henle, the distal convoluted tubule, and collecting tubules. A decrease in kidney function is due to a reduction in the performance of nephrons. Nephron is the structural and functional unit of the kidney. The word nephron is derived from the Greek word nephros, meaning kidney. They are microscopic structures composed of a renal corpuscle and a renal tubule. There are millions of nephrons in each human kidney. The structure that produces urine in the process of removing waste and excess substances from the blood. Functions of kidney. Excretion of nitrogenous wastes like urea, creatinine and uric acid, and other foreign substances. Regulation of blood ionic composition. Regulation of blood pH. Production of hormones. Regulation of blood pressure. Regulation of blood volume. Maintenance of blood osmolarity. Regulation of blood glucose level. Formation of urine. The kidneys form urine which passes through the ureters to the bladder for excretion. The composition of urine reflects the activities of the nephrons in the maintenance of homeostasis. There are three phases in the formation of urine: glomerular filtration, tubular reabsorption, tubular secretion, glomerular filtration. When blood passes through the glomerular capillaries, the plasma is filtered into the Bowman's capsule. All the substances of plasma except plasma proteins are filtered here. Plasma proteins are not filtered because of their high molecular weight. The filtered fluid is called glomerular filtrate. Tubular reabsorption. Both qualitative and quantitative changes take place when glomerular filtrate passes through the tubular portion. Large quantities of water, more than 99%, electrolytes, and other substances are reabsorbed by tubular epithelial cells. The reabsorbed substance passes into intestinal fluid and then into the blood. This is called tubular reabsorption. Sites of reabsorption. Reabsorption occurs in all segments of the tubular. Proximal convoluted tubule. Here the reabsorption of glucose, amino acids, sodium, potassium, calcium, bicarbonate, chloride phosphate, uric acid, and water takes place. Loop of Henle, sodium and chloride absorption takes place. Distal convoluted tubule, sodium, bicarbonate, and water reabsorption take place. Secretion. Some substances are excreted, into the tubule from the peritubular capillaries. Potassium is secreted in the distal convoluted tubule and collecting duct. Ammonia is secreted in the proximal convoluted tubule. Hydrogen ions are secreted in the proximal convoluted tubule and distal convoluted tubule. Maximum ions are secreted in the proximal tubule. Glomerular filtration rate. It is the total quantity of filtrate formed in all the nephrons in kidneys in a given unit of time. The normal value of GFR is 125 milliliters per minute or about 180 liters/day. Factors affecting glomerular filtration rate. Decrease in systemic BP. Partial obstruction to renal arterial flow. Inflammatory process. Increased resistance to flow in the tubular portion of the nephron. Decrease in osmotically active components of plasma. Glomerular capillary complex disease. Classification of renal function tests. To screen for kidney disease. Complete urine analysis. Plasma urea and creatinine. Plasma electrolytes. To assess renal function. To assess glomerular function. Glomerular filtration rate. Clearance tests. Glomerular permeability. Proteinuria. To assess tubular function. Reabsorption studies. Secretion tests. Concentration and dilution tests. Renal acidification.